Hello, I am Dr. Vikash Kumar. I am a consultant cardio-physician with National Heart Institute East of Kailash, New Delhi, and also with Sama Hospital, City Fort Road, New Delhi. Today's topic of discussion is that healthy diet for healthy heart. Why for our heart to keep healthy, a healthy diet and lifestyle is very important. So that will be the topic of discussion. As we know, we have a natural blood pressure, and this blood pressure fluctuates day to day, from day to night. It can fluctuate even every moment depending on the circumstances and emotional situation. So any blood pressure which is higher than normal for a longer period, that is basically called hypertension. And as we know, in our country, basically for the Indians, there has been a survey, and that indicates that one of out of four, each adults above the age of 18, one out of four is suffering from high blood pressure. We can just by this we can understand the volume of hypertension in our country. And this blood pressure is very important. As we know, if our blood pressure is on higher side for a longer period, it can damage our vital organs like heart, kidney, our vision, even our brain, because high blood pressure also causes not only heart attack or kidney failure, sometimes loss of vision. It sometimes also causes paralytic strokes and sometimes also brain hemorrhage like that. So there are so many diseases that is caused by high blood pressure for a longer period, and therefore persistent blood pressure more than normal, that is called hypertension, and it is an important factor. And in particularly seeing the volume of hypertension, particularly today's stressful life in our young adults at the young age, just above around 30 people are presenting with very high blood pressure, and for a longer period of the time. And irony is that most of the patients, they have high blood pressure, and they are not aware that they have high blood pressure or hypertension. And that's why this hypertension is also called silent killer, because majority of the persons, they are not aware that they have hypertension. And as I told you, this hypertension causes heart attack, heart failure, it can cause sometimes arrhythmia, it can cause strokes, it can cause renal failure, and so on. So this is also called silent killer. And as we know, many a times the hypertension may be because of genetic predisposition or familial inheritance, where we can't do much, but just by controlling our diet and healthy lifestyle, we can control our blood pressure. And also nowadays there are numerous other factors that is causing hypertension in young adults, like a stressful life, a daily consumption of alcohol beyond a limit, excess of tea, coffee, stress, lack of sleep. Eating habits is one of the most common factor for young adult hypertension nowadays. And so the healthy lifestyle and eating habit, healthy diet for healthy heart concept is being talk of discussion nowadays in the metros. Healthy diet for keeping heart healthy, and for this a new concept of diet, which is in short is called DASH, that is dietary approach to stop hypertension. that dash is basically to not only to stop hypertension as a prevention. If we can keep a healthy diet which is healthy for the heart, we can not only keep away this hypertension, but also we can keep under control this high blood pressure without taking any medicine. And so is the concept of DASH is the talk of the town at present time, for particularly for the young adults who are working under stress due to various reason. So this DASH, basically the dietary approach to stop hypertension. The first of this dietary approach is one of the commonest cause of hypertension, excess of salt intake. As we know, the salt intake is directly affect the blood pressure in day-to-day life. And if we reduce the salt intake, or if we take the salt in the permissible limit, we can control our blood pressure to the normal limit. As per the American guidelines, the daily salt intake that has been recommended as 2300 milligram per day, or 1500 milligram of sodium. That is equivalent to about 1 teaspoon salt that per day. So if we can reduce the salt intake, or if we keep the salt intake checked to the recommended level, we can keep our blood pressure under control, and we can keep our heart healthy. Like to keep salt intake to the permissible limit, we should avoid nowadays basically the processed food where the salt consumption is more than permissible limit. Before using any processed food, you must read in its composition what is the percentage of salt used in this processed food, and if the percentage of salt is more than the permissible limit, just simply avoid these food. Also, the using salt, sprinkling the salt over the food like green salad, curd, you can avoid the salt intake and keep the salt as much as minimum we can use in normal food, to keep daily intake less than 1 teaspoon. Also, another factor of this DASH is alcohol intake. The daily use of more than 60 ml of alcohol is in excess of alcohol daily intake, and binge intake of alcohol, more than 4 to 5 serving of alcohol per day is considered as binge alcohol, and binge alcohol is always associated with rise in blood pressure and ultimately hypertension. So anyone taking binge alcohol or alcohol in excess of permissible limit, they should cut down the alcohol and to keep our blood pressure under control. Another factors also in our diet, because as nowadays everyone drinks tea and coffee, it is part of our daily life, and excess of tea, as we know, the tea contains tannin, and coffee caffeine, both are associated with blood pressure. Not only with blood pressure, but also it raises your heartbeat, and raised blood pressure, raised heartbeat are one of the factor of microvascular complications like heart attack or kidney diseases or other vascular diseases. So you must cut down your tea intake and coffee intake in day-to-day life, and keep it in morning and evening, or maximum 3 serving of tea and or coffee in daily life. Also, to cut down these salt and alcohol, apart from salt, alcohol and tea, caffeine, what should be content in your diet to keep your heart healthy. And basically in Indian diets, as we know, our diet is basically carbohydrate rich diet, which is not only responsible for raised blood pressure but also for the diabetes, and both are deadly factors for the heart disease. So our diet basically for the young adult Indians, it is the strongest message from switch over your diet from high carbs diet to high protein diet, and your diet must contains fiber. The diet should be fiber rich diet that not only helps in the digestion of easily digestion of the food, but also assimilation and evacuation of the waste, ultimate waste of the diet. So eating more fiber basically is associated with a healthy heart. So these four factors of the diet appropriate to stop hypertension, that one is to reduce salt intake, keep it in the permissible limit, alcohol intake, reduce alcohol intake, cut down the tea and coffee intake, daily intake, and eat more of the fiber in the diet and less of the carbs to keep your heart healthy. Also, there is another factor which is in the diet is considered as Mediterranean diet, which is like a similar of the concept of DASH. In Mediterranean diets, it is recommended that of your 40% daily calorie or energy intakes should come from the fat, and 40% from carbs and 20% from the proteins, so that you can keep your heart healthy and control your blood pressure checked. And of these 40% of the fat, most of that it should contains basically monounsaturated fats in the terms of nuts and seeds and olives. So that is another concept of Mediterranean diet to keep your heart healthy, where 40% of the energy of your diet should be that comes from fat, and that maximum of the monounsaturated fat. Among the DASH, there are few recommendations how your the daily food intakes should be in terms of number of servings. The small and frequent diet is always recommended for your healthy diet. Keep your heart healthy and blood pressure under check. And of this small and frequent diet, like grains, it should be, the grains should be in terms of like small and frequently, basically as 7 to 8 serving in 24 hours. After the grains, like lean meats, poultry, fish, it should be not more than 2 serving in a week. And the vegetables, like 4 to 5 serving of vegetables every day. And fruits, the 4 to 5 fruits per day has been considered in the dietary approach to stop hypertension. Per day, the fruit intake should be 4 to 5 in 24 hours. Like that, the another factors that has been advised in the DASH is the low fat and fat-free dietary products. As we know, the dietary products in terms of curd, milk, chocolates, yogurt, all these are dairy products, and as per the DASH, your dairy products should have with low fat either low fat or if possible fat-free dietary products in your daily serving. And before, if you are using processed dairy food, you must read its the composition, what percentage of fat it contains. If it is more than a permissible limit, you must avoid these dairy products to keep your heart healthy and keep your blood pressure under control. Also, one of the most important part of the food intake is the sweets. As per the DASH, 5 or less than 5 serving of sweets in a in a week has been considered appropriate under the dash that is dietary approach to stop hypertension and heart diseases. So in nutshell, the dash, that dietary approach to stop hypertension, that is reduced salt intake. The salt intake should be less than 1500 milligram of sodium a day, or you can say simply 1 teaspoon of salt in a day. Your alcohol intake not more than 30 ml in 2 serving, that is 60 ml per day. If binge alcohol, it must be stopped and avoided. Cut down your daily tea and coffee intake. Eat more fiber in your the diet content, and the basic diet should contain the grain serving should be 7 to 8 serving per day. The lean meats, poultry, fish should be not more than 2 serving in a week. The vegetables 4-5 serving every day. The fruits and fruits like 4 to 5 a day, and low fat or fat free dairy products, nuts and seeds and beans 4-5 serving every day, and sweet less than 5 serving in a week. Or Mediterranean diet that contains the fat as a 40% of energy of your daily energy should be from the fat, and that of the most of that of the monounsaturated fat in like that of the nuts, seeds, beans as a source of fat and energy. So if you follow this dietary concept, new dietary concept for keeping blood pressure and healthy heart, apart from this stress-free life, one can easily control its blood pressure, and you can keep your heart healthy. Thank you.